All right, everyone. Eric and I are going to jump into a video right now, a long interview about his experience doing jaw surgery with Dr. Alfi. But just so you have some context, what we're going to do now before the interview is show you the molds that demonstrate his pre- and post-surgical facial structure, essentially. So Eric, we're going to dive right into that right here, okay? So this is Eric's before. This is Eric's after. Okay, so you can see this was the maxillary change. It was cut here, the Lefort cut, and it was advanced how much, Eric?
8 millimeters on the top.
Okay, and how about on the mandible?
The mandible right here, that was 9 millimeters.
Okay, and
then the genio was a, we ended up not doing the genioplasty. That was just planned.
so that's, this right here was nixed. Okay, you can see Dr.
Yeah.
Alfi had designed that custom pre-printed plate that would have been right here, but that was not done. And so really we're just looking at the Lefort and the BSSO. And what you can see here, and what about rotation?
Yeah, rotation, I got about a degree of clockwise rotation, or sorry, counterclockwise rotation, and then a 0.5 millimeter of impaction on the maxilla.
Okay.
Yeah. So it kind of came up a 0.5 millimeter.
And also what you can see in these molds are, and it might be hard to see it, but you can see the famous Dr. Alfi pre-printed plates. So right there, you can see the holes in where the screws go in, and on the maxilla, it's one contiguous plate that spans both sides. Boom, 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 boom. Across there's the plate going up, over, and across, and then up toward the zygomatic root and toward the zygoma. And that plate is in Eric's face now. It was used to accomplish the surgery, and it's there now, and it's holding this movement forward until the bone heals in 3 to 6 months. And on the mandible, same thing. You can see the shape of the custom pre-printed plate right there, holding open that, what was that advancement?
9 millimeters.
On the mandible?
Yep.
So you see the 9 millimeter advancement held open by this one pre-printed custom titanium plate. Again, we skipped the genio. And then on the other side, same thing. 9 millimeter advancement on the mandible. So let's put the before and after side by side. So we can see there the change, advancement of the mandible, advancement of the maxilla with a little bit of counterclockwise rotation minus the genio, and that was Eric's result. So let's dive into my interview with Eric right now about his experience having undergone this change. Also in the video, we're going to talk about a movement Dr. Alfi did to shave off nasal bone to improve Eric's nasal breathing, and that occurred. So this is the after. What Dr. Alfi does, and I witnessed this myself on 3 Procedures Monday, is he'll take his surgical saw and he'll cut a slice of bone right from there, and you can see that in this after, he'll drop the maxilla first, and then he'll take his saw and go right across there, and take a piece right from there to improve nasal breathing, because in a lot of patients with underdeveloped maxillas, there's a lot of excess bone here, which in the before, I guess you can see a little bit of that. Maybe I'll have Dr. Alfi explain it on a different model. But yeah, that's where this occurs. Maxilla cut, and then right across there with the saw, and we'll talk more about that later in the interview. Okay, Eric, so you're 5 weeks out of surgery with Dr. Alfi. What was the date of your surgery, do you recall?
Yeah, May 21st.
May 21st, and today is June 26th?
6th, yep.
Okay.
Yep, just over 5 weeks, yep.
So it's probably too early to speak on some of the final results that you're going to get functionally, aesthetically. You're still a little swollen on your upper lip. But what I really wanted to ask you about is, like, what was the experience like? What was the recovery like? How miserable was it? Obviously, jaw surgery has the reputation of being brutal, like one of the most brutal surgeries you can do in terms of recovery. But Dr. Alfi pitches his procedure as being shorter in duration, and it's 1.5 hours or 1 hour instead of 6 or 7 hours because of the custom printed plates. And because of that, there's less manipulation of the tissue, less anesthesia, less wrestling around with things, et cetera, which he says promotes a faster recovery. You know, less disturbance, less recovery. So just like overall, what was your experience with recovery? How bad was it, or was it not so bad? I'll give you the floor.
Yeah, so I guess leading up to the surgery, Dr. Alfi does a really good job of giving you the expectations about what recovery is going to be like, and I would say it's pretty much on the dot. So the first week is going to be uncomfortable with a pain level of maybe like 2 to 3. The first day or two is the worst. So I was in the hospital overnight, but just for one night. And I think that's typical for Dr. Alfi's patients. Although I've heard that some patients even leave like later on in the day if they're early in the morning. But yeah, so I stayed overnight, one night. Again, I mean, uncomfortable, but nothing too intolerable.
So when you say uncomfortable, like, what does that mean? Did you have like throbbing, sharp pains in your face, or was it?
No.
Like, what was the experience?
No, so no sharp pains, and you're pretty numb on around the teeth, gums, and then the chin. But it was more just discomfort when it comes to how tight your jaw is.
Yeah, what do you mean how tight the jaw is?
So all the muscles just feel tight, like you have no range of motion with your mandible, other than a little bit of up and down.
Like in terms of opening and closing?
Yes, opening and closing.
Huh.
Yeah.
And is that just from the surgical manipulation, or is that from
I think it's the soft tissue, the soft tissue is being stretched.
Right. Oh, by the way, we should clarify what you had done.
Yep.
So, can you tell us like what Dr. Alfi actually did?
Yeah, so his movements were 8 millimeters on the advancement for the maxilla, 9 millimeters advancement on the mandible with a 0.5 millimeter of impaction, and then
no genio.
No genioplasty, just a slight counterclockwise rotation, I think 1 degree.
Mm-hmm. So you had double jaw.
Yep, double jaw.
And so for perspective, we're talking recovery here from double jaw surgery. Okay, so Dr. Alfi, I've been shadowing him all week, and for all the patients that ask what recovery is going to be like, he says the first week is really bad, and then it quickly starts to get better. That's kind of like his go-to explanation. Does that jive with your experience?
Absolutely, yeah. For me, it was day 6, day 7 that it was kind of turned the corner, when it was like, yeah, you mentally feel good. Mm-hmm. Mm-hmm. Yeah, I would agree.
And so after the first week, then what is the experience like in terms of getting back to normal life?
Yeah.
What did you look like after 1 week?
So I looked pretty, it was peak swelling for sure.
At about 1 week?
Yeah, day 4 and 5. So I guess I was a little bit of a unique case because immediately following the anesthesia, when I woke up, I bore down. I don't even remember this, but I bared down and then sent all the blood up to my face, and it resulted in a rupture of a blood vessel, I think around here. So I had to go back in for 15 minutes. So the whole procedure for the double jaw was an hour. Then they woke me up. That event happened, and then about 15 minutes to get the, I don't know what it was called.
Cauterize that blood vessel?
Yeah, exactly. And so then that event led me to swell.
They put you back to sleep for that?
I believe so, yeah.
Yeah. That's all very fuzzy for you?
Yeah, the whole thing is. The only thing I remember is waking up after that second event, and I could hear Dr. Alfi say, hey, like, just want to let you know you got a really good result. And that's the only thing I remember. So then the rest, it was kind of a daze as they were carting me over to the room, the recovery room. Where you would spend the night? Yep.
Or where you would rest for a little while before going off to the hospital room where you spent the night?
Yeah, yeah. It was no, they just sent me straight to the recovery room.
Oh, okay.
Where I spent the night.
Yeah.
Yeah, and that was all pretty smooth.
Mm-hmm. What about like talking and stuff?
Yeah.
What was that like? So, by the way, just to set the stage, another difference between Dr. Alfi's surgery versus the way traditional double jaw surgery is done is you don't need to be wired shut with Dr. Alfi's surgery, because the way that the bite is determined with Dr. Alfi is through the custom printed plates. Essentially, you follow the plates, and we'll have a visual on this either in a separate video or later in this video, depending on how it's edited. But normally the way jaw surgery is done is they wire you shut on top of the braces that you would have to have, and then that is sort of your bite, and then they manipulate those two pieces together, I guess. I've never actually seen it done, but so when you wake up, you're still wired shut. You can't talk, obviously, if you're wired shut, and
Right.
It's kind of a scary prospect. But with Dr. Alfi's surgery, they have the custom printed plates, and that determines the bite and the final position, so it negates the need to wire anything shut. So, but can you actually talk, like when you wake up?
Yeah, so you can talk right away. I mean, it's a little restricted. Really, talking becomes easy maybe like day 3.
Because like, what do you feel? Like you go to talk and it's just like, like you don't want to open too wide?
Exactly.
Is numbness a factor?
No, not for talking. It's more, it's just more how stiff your mouth is in the range of motion. But you can still talk. You're not, yeah, and like I said, I mean, half a week, it becomes pretty easy.
Yeah.
Yeah, for sure.
And so when did you start eating after your surgery?
Well, so you can have soups. Are you talking about like even just
whatever, any kind of nutrients besides salt water?
Okay, so I'm trying to think here.
Because I've been hearing him say all week,
you
can't chew for 8 weeks.
Right.
And then some patients have come in at 7 weeks and they're like, am I ready? I really want to have like something soft to eat, like a pancake or a soft burger from Shake Shack. But he says, nope, you're at 7 weeks, 1 more week, no chewing. Because if you chew, the bone hasn't healed in the advancement locations. It's still, a void there rather than contiguous bone. So if you chew, you risk compromising the plates and therefore compromising the final location of the jaws, the bite, et cetera, et cetera. So you're not even 8 weeks out yet. You're still in that 8-week window where you're not chewing. So like, what do you eat?
What do I eat?
Yeah.
Yeah, so I mean, it kind of, so it's a combination of smoothies. So I'll try to pack in as much, of the 3 macronutrients, carbs, fats, and proteins within the smoothie. Greek yogurt, protein powder,
little probiotic,
avocados. Yeah, exactly.
Avos are a good call.
Yeah,
they're good even if you haven't had jaw surgery.
No, exactly. It's a great addition to a smoothie. Maybe. Yeah. And then I'll try and blend up food. So I spent the first 2 weeks at my parents' place. So, for the family, lunches and dinners, we would just make the food, and then I would have what they ate, just blend it up.
A lot of 30-year-olds are moving back in with their parents.
You should do it too. Just for 2 weeks, though. Right?
Okay, all right.
Yeah.
So then you make this sort of puree.
Yeah.
And what do you just eat it with a spoon?
Yeah, with a spoon.
Like a big baby?
Yeah, with a spoon.
Just,
exactly.
Did you have
like
mom
a baby.
feed you?
So it's so you kind of get used to it because your lips are numb. So you're I've been a messy eater. Yeah, I've
really?
one hand with a napkin and the other hand with the spoon a lot of times. It's not too bad.
Because you can't feel the lips opening, or you can't feel the food landing on the tongue? Is the tongue numb? Or?
So the tongue is never numb, fortunately. I've heard that they really do a careful job of not messing with that nerve. But the gums, the teeth, and the lower lip. So if there was some food on my lower lip, I couldn't tell. You know what I mean?
Yeah. How's your lower lip right now? Still numb?
Still numb. Yeah.
Chin?
It's still numb.
And you asked Dr. Alfi about that. He said it could be a year before that sensation comes back.
Yeah, I guess so.
Par for the course. Yeah, he's been telling people that all week.
Yeah.
It's just, that nerve is just kind of a bastard, but it always comes back.
Yeah.
It just takes some time. So that's your experience, though, is there's definitely numbness from here down.
Yeah. Yep, that's my experience. And then, it was like that from the beginning. I never had numbness in the maxilla areas, the upper lip or the cheek. Never had numbness there. Kind of a thing I didn't expect is it's hard to shave right here. Especially with my kind of bony chin.
Yeah, speaking of that chin.
When you can't.
Your chin bears a striking resemblance to Mount Jawmore.
There we go.
So
is that Abe Lincoln there?
That might be Jefferson.
Or is that?
I think Abe is
there's Abe Lincoln, that's right.
Well, with that jaw, that's Babe Lincoln.
Babe Lincoln.
But you were saying, this is, Dr. Alfi had this mural done by the same gentleman or person who did his Kobe mural in the other room where we're going to shoot the podcast tomorrow. But welcome to Mount Jawmore.
Mount Jawmore, that's right. This is the rite of passage to Mount Jawmore, is getting through MMA.
Getting through a custom double jaw?
Yeah.
But what were you saying about shaving, though?
Yeah, so I got to shave for work. So it can be problematic. Sometimes I've had to just shave around and then keep the little hair on the chin. Yeah, or do the electric razor, but even then that's hard to get a close shave. So that's been hard. It's hard to shave when the skin's numb.
Yeah, because shaving, you have a blade, and if you don't take feedback, you could cut yourself, and for sure. Yeah. It's amazing how much of what we do depends on really fine tactile feedback and like dexterity that we're getting from touch. But I can imagine.
That we take for granted,
That we take for granted.
Yeah, but thankfully the tongue never gets numb. The palate does get numb, which affects swallowing. Like, it was kind of uncomfortable to swallow and eat the first, I would say, week, and then you get used to it. They don't want you using straws because the suction pressure could open up wounds in the mouth. But
how's the palatal numbness now at 5 weeks?
It doesn't affect me. I can't really tell, to be honest with you. I think it's still there, but if I'm feeling it with my tongue, it's hard. Yeah. And it's not a numbness like it's tingling. It's more just you can't feel anything. So it's not a discomfort. Yeah.
Right.
But sometimes you can kind of feel a little bit every now and then, the tingles. Maybe that's a good sign when it's coming back.
Nerves do weird things when they start coming back online.
Yeah.
They can tingle, they can pin and needle, they can get really itchy. That's one thing that happened to me after my migraine nerve decompression surgery, is I would get this deep, unscratchable itch, and I would want to just rip my skin off. It was so uncomfortable, but the doctor told me, listen, it's a good sign. It just means the nerves are coming back online, they're healing. So nerves are weird.
Yeah, nerves
are super weird.
And I can see it driving you crazy if it's if it's tingling like that.
Can.
Yeah.
where it's way too soon to judge final outcomes on breathing, on sleep, on aesthetics, but snap judgment. How has your breathing felt? Before surgery, you presented as someone who struggled to do nasal breathing. You had considered doing a MARPE. Dr. Alfi told you, hold off, let me just shave some of your nasal bone. We're going to see that tomorrow when I film the surgery. The way Dr. Alfi takes a nice, like 1 to 2 millimeter thick sliver off the base of the nose, the bone, to open up the nasal airway. He did that for you. Honestly, like, how's your nasal breathing been? Did jaw surgery improve your nasal breathing? What's been your experience?
Yeah, definitely. So I think it has improved it. Beforehand, it wasn't a clear case of like stuffy nose before and then clear nose afterwards. I felt my nose was, relatively clear, but smaller beforehand. I think it has improved. Dr. Alfi let me exercise 3 weeks after the surgery. That's when I asked him. I mean, perhaps even before he would have let me. But when I was doing the Stairmaster for cardio, I mean, I kept my mouth shut the entire time, and it was effortless.
Wow.
So that was and I got up to one of the highest settings on the Stairmaster before I could finally call it. But but it was I mean, like you like to say, exercise while nose breathing is bliss. It felt really good. It felt like I could get more air in through.
Prior to jaw surgery, what would your breathing be like on the highest Stairmaster setting?
So I could still, I mean, it definitely tested. Yeah, for sure. Like I wanted to open my mouth out up to compensate. But I was still pretty good beforehand, but this is better, for sure.
Sleep, where are you at with that?
Sleep?
What was your sleep like before? Were you a horrible sleep apnea case, AHI of 50? What was your deal, and like before and after? Give us some perspective.
So I had AHI, RDI of 15 events per hour.
Mild to moderate?
Yep, mild to moderate, and most of it was hypopneas or raras. Okay. So none of the oxygen desaturations or significant oxygen desaturations. It was more just arousals.
Yeah. So kind of a standard UARS case, exactly, even though Anil Brahma says UARS doesn't exist anymore. It's just different gradients of sleep apnea. But you're like...
It was a classic UARS case.
Yeah. Young, not overweight, lots of disturbances, but not a lot of actual deep desats where you're getting 90% drops in oxygen. It's more of that constant surface level hum of bad sleep.
Exactly, yeah.
Lots of mild to moderate sleep disturbances.
Yep. I mean, that's exactly it. So, and sometimes I would be conscious of waking up during the arousals, but oftentimes I wouldn't. So that was, I mean, a big thing was I felt like I was constantly waking up every maybe hour for every 45 minutes of during the night. And then it was hard to get up in the morning, no matter how much sleep I would get. Yeah, so, I mean, post-jaw surgery, it can be hard to tell because so the first, what was it? Definitely the first few weeks, you're upright. So whether it's you're upright at the hips or you want to get a full upright bed, I took a couch and then put the legs on one side elevated on some wood to sleep, and that's to get the swelling down. And then I'm sleeping upright still.
So the purpose there is you want gravity to move the fluids down rather than pulling them up at the site of the wounds. Is that a pressure thing so that?
Yeah, you can feel the pressure, and even if even if you bend over, you can feel it. So yeah,
no inversion table.
That's exactly no inversion table.
Yeah,
So,
interesting. So,
yep.
so Dr. Alfi told you to sleep inclined?
Yep.
For how long?
So I think it was like 2 weeks. There wasn't a strict timeline for that, because that's mostly to get the swelling down. And then once the swelling is significantly down, it's less important. So, but I also had to sleep on my back and upright, in a sense. So, the sleep is not, it's fine. But I still struggled to sleep a little bit that first week. And then after 2 weeks, kind of started sleeping on my side again. Maybe it was 3 weeks, yeah.
At 2-3 weeks, did things really start to normalize at that point?
Exactly, yeah. So the way I would characterize it is the first week is like you probably don't want to go back to work, but after that first week, you start to feel good. Like you're turning the corner. And then after 2 weeks, it's like, okay, I can go back to work and be fully productive. Like you could probably go back to work after 1 week, but you're still a little compromised. After 2 weeks, like I was finishing up grad school and a thesis, and I felt like I was able to be productive all day.
Wow.
After 2 weeks.
Did you defend your thesis yet?
I presented it, yeah.
Nice.
In fact, I presented my thesis, let me try to think here. It was right when I got back. It was 2.5 weeks after jaw surgery. Yeah, so I was a little swole, a little tight, but I was able to give a public presentation in front of 30 people.
2.5 weeks.
2.5 weeks after double jaw surgery.
From having your maxilla split off your face, your mandible split off your face, plated forward, which is completely different than the way we're told jaw surgery recovery is, where that you're totally incapacitated for months and you don't look normal for a year, and like 2.5 weeks?
2.5 weeks.
2.5 weeks later, you publicly spoke. And did one of the most important, presentations probably that you'll ever give, or that you've given up to this point in your life. And did you feel and look, did anyone even know that you had a major surgery? What was the swelling like at that point?
Yeah, the swelling really came down after day 10 to 14. Like it was like I started to look normal. And then the changes were subtle. I mean, some people could tell that maybe I looked a little tired.
Yeah.
But most people that I interacted with couldn't tell.
Yeah. And at this point, you're still swollen mostly on your upper lip.
Yeah.
Yeah. And Dr. Alfi was explaining to you before that that's the last place that deswells.
Yeah.
And that it could be a while. He even said it would be, did he say 6 months until you're gonna be totally like final form?
Yeah, he said the final product, it could be a year.
Right.
Is like but maybe four months.
Till you're 90% there. Yeah.
Yeah, probably even more than that, 90%, yeah.
Yeah.
Yeah, so that was another thing, was like, being all swollen up, you're worried, like, what was the aesthetic outcome of the surgery? Because you don't know. Even now, I still don't know for sure.
Right.
One of the cool things that Dr. Alfi did though was that he took a picture of me on the operating table before, right as he was getting it all set up, and then right after he was done, closed my mouth. I don't know. Have you seen him?
He does
do it with
that for
his
every
patients?
patient. Yeah.
Yeah. So
3 for 3 the other day. I watched him do that.
Yeah. So he sends you that picture, and so you kind of get an idea of
the advancements.
Yeah. Yeah. So it kind of gives you a like. It calms your mind about the aesthetic outcome.
Totally.
Yeah.
And I've heard him explain it as you still look like you, but with a permanent filter. Like
I like that.
A refined version of yourself.
That.
What's been your experience with having this new face?
Mm-hmm.
Do you like it? Have people commented? What has your mom said, for example? Because moms usually offer a pretty interesting perspective.
I'm actually glad you asked that, because that was one of my biggest reservations behind the surgery. was the body dysmorphia that potentially could come out of it. And that is something I had heard about Dr. Alfi, was that his patients look like themselves, just enhanced.
Yeah.
You know, the before and afters, all the patients, they still look like they don't look unrecognizable, but they look better. Mm-hmm. And I think that was definitely the case for me. I was worried that I would have the body dysmorphia, but I don't.
Yeah.
You know?
Yeah.
I think I was just so, task oriented, getting through the procedure and the recovery, to think about it too much. But I no issues there. I like the way that I look better.
Yeah.
For sure.
Yeah. So we didn't really talk about this, but you and I had been speaking for what, a year since? When did we first meet?
November, I think, ish.
Okay.
December.
So you had signed up for a one-on-one coaching session with me to talk about your general situation, and that was part of what brought you here. Mm-hmm. So I knew you long before surgery.
Yeah.
And so I can tell that you look different. I can see a major improvement, specifically in your neck posture, which has straightened out a bit. And that was one of your original complaints, right?
Was one of my chief
neck?
complaints, yep.
Tension too? Or?
Yep, neck tension in the back here.
Yep.
In the forward head posture, that was definitely a chief complaint I had.
Another thing that I distinctly remember about you all the times that we talked was that you would have these mean bags under your eyes. You still got a little bit of that. It's been a tough 5 weeks, but your eyes are looking a lot brighter and a lot more clear. So that's one thing I see.
Good.
Obviously, there's still some swelling in your upper lip, and it almost looks like the chimp lip, as you cause it, right? Because that is an outcome that some people get with a jaw surgery, is like if their upper jaw is advanced, maybe is it result from being advanced too much, or maybe it's just like the upper lip is incompetent, and plus a little bit of over advancement, and you can get kind of like a that sort of thing.
It's
but
too filled in. Yeah.
I'm seeing that effect, but I don't think it's chimp lip. I just think your lip is still swollen, and I'm judging that based on the location of your teeth. It's not your maxillary bone that's all the way up there. It's just a fat lip. And that's something we talked about with Dr. Alfi. But I'm really liking your mandible, especially. Looking like, especially with your style, it's kind of like a Nantucket, like Abercrombie model type vibe. You're tall kind. Too. You're taller than I realized.
There we go.
So, man, you're gonna do.
I've always had the height, but now I got the jawline to complement it.
Yeah.
Yeah.
And I think you were kind of a fence case before, and my impression is that Dr. Alfi didn't go crazy with you. All your advancements were sub 1 centimeter. Yeah. And compared to some of the ones I saw on the more retrognathic patients on Monday, which were, 2 of them were over 2 centimeters on the mandible.
Yeah.
So that wasn't you. Everyone gets their own plan.
Yeah,
you got less than half that because you weren't that bad to begin with. So yeah, man, I'm liking what I see. To wrap up, just so are you glad you did it, or and beyond? I know we're in Dr. Alfi's office, and there's probably there's like a subtle pressure to be biased into saying, oh yeah, it was great, it was awesome, so everyone should come see Doctor. But honestly, are you glad you did it or not?
Yeah, so I'm super glad I did it with Dr. Alfi for one.
Okay.
You alluded to we'd been talking for the last 8 months or so about my case and what treatment I should eventually elect to do. And it wasn't until I saw your interview with Dr. Alfi that made me consider jaw surgery in the first place, because that was that fence case. And so his minimally invasive, more reliable, safe procedure was the only reason why I did it to begin with. Because when you first brought it up, hey, I could be a candidate for double jaw surgery, I was like, oh heck no, I'm not.
I remember that.
What I mean? I was like, please, let's talk about something else. Yeah. So and then I was worried about bad outcomes with the jaw surgery.
Who wouldn't be?
Right, exactly. And I could say I haven't had any so far.
Yeah.
The recovery's been easy. You know, I was able to get back to work, you know, a week or two afterwards. Very little pain. So I would say like all the, you know, and then the benefits that have come with it, the improved nasal breathing, and the aesthetic outcomes. And then, you know, with the neck posture. But all these things I think are going to be, are going to come over time.
Yeah.
So, you know what I mean? It's going to be more subtle.
Yeah.
So yeah, I mean, I would say overall, yes, I'm glad I did it.
Yeah.
So.
I want to piggyback off something you just said though, because this is more and more, I think, coming into the paradigm of the jaw hacking world and the airway health world, is fence cases like you, that by the way, 90% of doctors and dentists would have looked at you before surgery and have been like, you're fine, man. You're just dealing with, you know, there's nothing wrong with you. You need to, maybe you need a stimulant medication. Maybe you need modafinil, or maybe you need some Adderall, or maybe you need to do some blood work to figure out what's causing this sort of sense of chronic fatigue and lethargy and brain fog. 99% of doctors would have said there's nothing wrong with your structure.
Right.
And yet you go from looking like a healthy American physique and facial structure to having what is considered to be the most barbaric surgery that there is, which is the double jaw. So, and I saw that paradigm shift happen in your consciousness over that 6-month period, from that moment where you told me you're unhappy with your neck posture, you're unhappy with the position of your tongue in your mouth, it splays out, it spreads wide, it wants to come out forward in front of your teeth, your tongue falls into your throat when you sleep. And I remember at that point I said, well man, there's really no other way to like address that than with jaw surgery. Like there's unfortunately no quick fix for AP deficiency. Like there's just jaw surgery for that. Sorry, but like your chief complaint is addressed with jaw surgery. And then you were like, oh no man, screw that. I may be MSE, like I'm intrigued by this MSE thing, tell me more about that. And I was like, yeah, you know, that definitely could help your nasal breathing, but it's not gonna help your AP. Fast forward, you watched my interview with Dr. Alfi, and you did jaw surgery. Like you went from being 99% of doctors would tell you you were normal and fine to doing this jaw surgery thing. So like, how did that transformation happen throughout your research process and your sort of soul searching?
Yeah, so there was, I consulted with a lot of doctors, and you know, sleep doctors, orthodontists, and jaw surgeons,
including Anil Rama, by the way.
Yes,
right?
that's right.
You were one of the people who told me about him in Rhinomanometry. But anyway, continue.
Yep. So yeah, I mean, Dr. Rama, that was definitely one of the key moments, right, for me, was because I had initially done a home sleep test over a year ago at this point. I mean, my RDI was like a 5 and my AHI was 0. So, and yet I wasn't sleeping that well. So I was that stereotypical case where the home sleep test, you know, misses the sleep disordered breathing that is apparent. And that's when I got you know, I was going to go through insurance and do a sleep test, but the you know, the earliest they could book me was October this year. So
October 2024.
Of 2024, right? So then I remember I was in Palo Alto with a consult with Dr. Lee.
Dr. Casey Lee?
Dr. Casey Lee, yep.
For ease?
For the ease. He said I was a candidate for ease and MMA, but he wanted me to get a sleep study, and I asked him who was someone good, so he gave me Anil Rama's card. I'm in Palo Alto that day. I stopped by his office in further south in Saratoga, and I asked if I can get a sleep study done, and they could give it to me that night.
Yeah, he does that at the hotel, right?
Yeah, yeah.
Did the technician go and actually meet you at the hotel?
The technician meets you at the hotel, suits you up, and it's a nice hotel that they have too. The whole thing is very pleasant. The town of Saratoga, I would highly recommend it.
And that's all important because when you're doing a sleep test, you want to mimic like what you might sleep like in your actual bed, where presumably you would be comfortable, settled in, and not in some lab where right before you go to bed they shut off the overhead fluorescent lights and like you're still frazzled, and you're not going to get reliable data from that because that's nothing like how you actually sleep. Exactly,
yeah. This place is very comfortable. Yeah, it was still hard to sleep for sure with all the attachments. But he was able to get the sleep test analyzed, and I got to see him like 3 days later. And really what he does, and he explained this more thoroughly in your podcast, but it's almost like a general health survey, right? I mean, he's measuring your brain health, your breathing, your lip and tongue strength, your posture, kind of takes that. And then obviously the polysomnography, the actual sleep test data. And that's when he kind of identified 15 respiratory events per hour. And then some issues myofunctionally with my tongue strength, and but yeah, that was really when he diagnosed the sleep disordered breathing aspect of it. And then now apparently he does the CBCT scans as well. So it's almost like a one-stop shop, other than getting the actual procedure done. But that's kind of what turned me on. Is like, okay, I need to make the adjustment to fix this.
Right.
You know what I mean?
Once you knew that this wasn't in your head, you were actually sleeping suboptimally.
Yes. And there were symptoms as well in terms of fatigue that he could measure with the brain map. So, because, using one metric, there could be a lot of noise in that metric, but if you use an ensemble of them, holistically, it gives you a better idea. It gave me a better idea that, hey, there's actually something wrong that I need to fix.
Right.
Yeah.
Yeah.
So then...
You get that ensemble with Dr. Rama.
Yeah.
You get the CBCT.
The Rhinomanometry was the other one that he did.
The Rhinomanometry.
And by Rhinomanometry was atrocious, so...
You're the one who introduced me to that term.
That's right.
I never heard that term before you told me about it. I remember writing it down in my Apple Notes app while I was making believe like I was paying attention to you. I was like, Rhinomanometry. I got to look that up and make sure I know what that is.
And I know you talked about it a little bit with Dr. Rama, but what further research have you done afterwards?
Not much, man. I just know that it's a tool that someone had invented, an objective way of measuring nasal breathing quality, and he's pretty much the only person who uses it.
Yep.
And that the big pitfall that sleep doctors fall into is that they'll get a false negative sleep study, and they'll cut a patient loose back out into the world with that false negative. Meanwhile, if they had just measured nasal breathing, they would have seen, okay, the sleep test is negative, but this person, objectively speaking, has a ton of nasal resistance.
Right.
And combine that with this other study that Dr. Rama likes to talk about and that he linked me to, which is that even patients with negative sleep studies, but that have measurably high nasal resistance, all suffer these symptoms and have these negative outcomes, which is to say, poor nasal breathing, as measured by a rhinomanometry machine, is just as damning as a sleep test with an AHI of XYZ. So rhinomanometry is an important metric to catch and can help you, not let a patient fall through the cracks when they have a negative sleep test, a false negative.
Right. Because I mean, Dr. Rama mentioned this, that hey, it's not so much like a sleep problem; it's a breathing problem.
Exactly.
And that persists throughout the day as well. Exactly. That's something you can measure. By measuring the pressure at the inlet across or against the flow rate, the measured flow rate, and the slope of that, or the inverse of the slope, is the resistance. Right. Yeah. And so you want that vertical line, which means that there's a lot of flow for a given pressure drop.
Yeah.
whereas my line was flat. So, yeah, that was another. I mean, because and Karen Davidson, who's the one that I guess presents a lot of the, and this is where he got the Rhinomanometry from. She told me, she was like, yeah, the perception of breathing is different than actually breathing. So I didn't necessarily feel like my nose was clogged. Like it wasn't stuffy where like you could blow it out with a Kleenex. But according to my Rhinomanometry as well as my sleep study, there was compromise in the nasal breathing.
Yeah.
Right. So, and that's what led me to explore doing ease with Casey Lee as well, and kind of debating on whether I should do MMA or ease, and if I were to do both, in which order. And it was a tough decision, for sure. It was a tough. Honestly, I was about to make the call and schedule my appointment for the ease. This was around February this year. But I saw that Dr. Alfi had an opening in LA, and I lived in California. So I was like, oh, I'll just see him, right? Yeah. Because, he was watching his interview was kind of what was the starting point for me even to consider jaw surgery. And that's when he introduced to me, he's like, hey, like jaw surgery can help nasal breathing. Which
was a totally foreign concept
that
to
was
me
a paradigm shift.
Until, I started becoming really interested in that question when we spoke as you were getting cold feet before your surgery.
Definitely. Yeah.
We spoke and you were like, hey, my nasal breathing is bad. What should I do? Should I do ease or should I just go right into jaw surgery? Dr. Alfi says the jaw surgery is going to help my nasal breathing. He says I don't need ease. What do you think? And I was like, no, man, I don't know if jaw surgery can help the nasal breathing. That doesn't really make sense to me. Maybe you should do the ease. And I think that was my position. I pretty much told you, do the ease first. Like even though I'm here in Dr. Alfi's office, I pretty much said, don't do the surgery, do the nasal expansion.
Yep.
And then you were like, but Dr. Alfi said that he does this special maneuver during the jaw surgery where he can open up the nasal aperture surgically. And I was like, what? He can say that, but what is he actually going to do? Words are, talk is cheap.
Absolutely, yeah.
But then you were like, well, he drew me up this diagram. He says he removes bone here and here, and that opens up the nose. And then I was like, I don't know if I buy it, man. Do the ease.
Yeah.
Right? But then Monday, I saw him do this to 3 patients. And I'm gonna try to film it tomorrow. It's a kind of a special thing that Dr. Alfi does because he thinks in terms of airway when he does jaw surgeries, whereas it's kind of a foreign concept to people who watch my channel, but most orthodontic surgeons are just trying to fix occlusion. They don't even look at the nasal aperture because they're not thinking in terms of breathing. So it's like just a small cognitive leap to like, oh, breathing matters too. How can we augment the jaws to improve breathing? To like, okay, well, surgically I have this opportunity to open up the nasal aperture by literally removing bone, like right here. He cuts off like a 1 to 2 millimeter, don't quote me on those numbers, but he cuts off a 1 to 2 millimeter slice of bone after he drops the maxilla, right off the top of the maxilla at the nasal floor. And so I saw that, it's real. And so we got off on a little tangent there, but bringing it back full circle, maybe if you do jaw surgery and you do that, maybe you can skip the MARPI.
Yeah,
and avert,
we'll see.
Yeah, we'll see.
So, yeah, that was definitely a big, that turned me on to, hey, like maybe I should do MMA first, right? Because he did mention, he mentioned that maneuver. He mentioned the relative winding effect by just advancing the maxilla.
Yeah.
And then also he emphasized that, the septum, he tries to straighten it out. He doesn't guarantee or promise that it's going to totally straighten like you would do a septoplasty, but he would try to straighten it out enough to remove any obstruction or any contact with the turbinates or And so that was another thing, because I know people, it's common to, like post MMA, the septum gets even more deviated, or it's collateral damage after the MMA, but Dr. Alfi is very conscientious of that, and he even tries to straighten it out more. So those three kind of factors led me to believe that, hey, I had enough confidence that there would be at least some nasal breathing improvement.
Right.
Enough to go in, but we'll see. I haven't done a rhino test yet, but I do feel better already.
It'll be interesting to do an after rhinomanometry test to just objectively measure how much the nasal breathing has improved. But while we're on the subject of like, can you skip MARPE and just go right to MMA, you mentioned the relative widening effect. You sort of said that in passing, but it's actually a really important concept, which is kind of hard to wrap your brain around. But this idea that even if you don't widen the maxilla with a MARPE, that you get the sense of it having been widened in the transverse, the left-right, by advancing it. Because the wider part of the maxilla, which is back by the second molar, comes forward, which means your tongue feels like it has more space because the wider part of the maxilla is more prominent, or there's more of that wide area for your tongue to occupy. Bullshit, not bullshit. How's your tongue space? How is your mewing?
So that's actually one of the things. My mewing has gotten a lot better. My tongue would always scallop over the sides of my teeth, and now I can open up, and there's very little. That was one of the things that I was debating, because that's something that Dr. Alfi told me, was the relative widening effect in that. And it's one of the reasons why, for improved mewing, was why I wanted to do a MARPE or an ease. I've been happy so far with it. So I don't know if it would get you quite the same effect that a palatal expander would be.
Yeah.
Yeah, and some of it could be I'm still a little stiff all around. But yeah, I would say that
it feels wider?
It feels wider, for sure. For sure. Like every day I kind of look to see where my tongue is on the roof of my mouth, and it can fit without splaying.
Nice. Fits a lot better?
It fits a lot better.
Do you feel like you could use a little more?
I could definitely use a little more.
We could all use a little more, right?
We could all use, exactly. Yeah, for sure.
A bigger palate, a new suit, and a haircut.
Right.
Could always use those things, right?
Yeah, we could always,
No, for sure.
For sure.
But then it's like you get back to this question of, because this was also a big part of your consideration, I'm sure tons of people can relate to this. Do I want to go through the MARPE?
Yeah.
The potential asymmetry, the 2 years of orthodontics, the this, the that. It's a hairy process. So it's like, am I okay maybe compromising something to avoid all that, to save 2 years, to save, another 15 grand, time, money, risk,
Exactly.
Was that part of your calculus?
Yeah, 100%. Yep. That was part of it. I move every, 2-3 years, and I was about to move. So I would have had to do the ease with, because it was really Casey Lee's ease, since I lived in Northern California, and then it was that or the MMA, and I was going to move, so I would have had to do that remotely, at least part of it, and then it was one of those things where I didn't want this to be in my life for 2, 3, 4 years. I wanted to kind of get.
You want to never have to see me again at some point, right?
Exactly.
No hard feelings, man.
No hard feelings.
I want that for you too, right?
Yeah. But,
my stuff's entertaining,
right?
But it's like at the end of the day, it's a raft to get you across the river.
It's a means to an end. Right. Yeah, for sure. But I was willing to do it. I was 100% willing to do it, and I had heard that you can't, say if I needed to do the ease, or a MARPE afterwards. I heard you can do it after MMA with the plates. Casey Lee said he's done many of them with the plates, and then Dr. Alfi said, hey, if the plates are a problem, we could take them out afterwards.
Yeah. I just saw him remove some plates this morning. Really? Yeah, it happened.
How was that? How was
he did it in clinic. The patient, the anesthesiologist, Dr. Alfi has an anesthesiologist who comes into this office, which is not where he does MMA surgeries. He does the MMAs at Houston Methodist Hospital, where there's access to emergency medicine if needed, if something goes haywire. But the plate removal was right here. It was just one lower plate, actually. But yeah, the guy was sedated. He flayed it open. He unscrewed the plate. He removed it. And that was that. And he said more and more people want plate removal just because they don't want the titanium, they don't want the metal in their body, and he's totally cool with that.
Yeah.
And can get that covered by insurance too.
Oh, really?
He just says the plates are bothering them, because they are, and then has them removed. It's pretty straightforward.
Yeah, that is. Yeah, so it's...
It says anytime after 6 months.
After 6 months
for plate removal.
Okay, so that's good. I mean, I guess if it's not a problem, that's great. If it is, and if someone's worried about having plates in the face for whatever reason, even if it's just psychological.
Yep.
Although I don't really think about it anymore, but can't really tell. I'll probably keep it in for a little longer if I do remove them.
I would.
Yeah, for safety.
I did that with my MSC. Yeah. Everyone said 6 months. I kept it in for 9.
Yeah.
Just because.
Yeah, exactly. Just for safety, right?
Because why not?
Yeah. Yeah.
It's like for the next 50 years, I can suck it up.
Right.
Do a little safety on the other end, little margin of error there,
Right.
Yeah.
But yeah, I mean, tailing back to what we were talking about, MARPE versus MMA or both, or what do you do? I mean, for me, it was a very personal choice. I mean, I think that there are many circumstances where it makes sense to do the MARPE first. I felt that my primary deficiency was the AP dimension, both in terms of tongue space, pharyngeal airway space, and aesthetics. So I went with that, and if I had any issues, I could always reattack. But my hunch was that it would be a 90% solution.
Yeah.
You know what I mean?
Yep.
But narrow palates. If you have very compromised nasal breathing, it totally makes sense. I was this close. I was this close to doing the E's first.
Yeah.
For sure.
Yeah,
so
yeah,
it was definitely. I thought it was an edge case.
Yep.
But we'll.
Well, man,
time will tell.
Time will tell. You made it out the other end.
Yeah.
I'm already seeing improvements. Congratulations on taking the plunge and getting through the potentially nightmarish recovery, which wasn't so. Best of luck to you going forward. Maybe this is it. And maybe you'll really be able to put this stuff behind you and just start living your life, which, as I've been saying a lot recently, that's really the most important thing. This is just sharpening the knife. Now you got to go out and cut shit with it. Live your life. How old are you?
31.
31. I'm 34, so a little older. But I hope that all that you want to accomplish with your career and your relationship stuff, that it's all just a little bit easier now that you did this. And man, I thank you for sitting for this interview and making yourself exposed and vulnerable to the JawHacks channel and audience. And I just really wish you the best, man. I'm happy for you.
Appreciate you, man.
You got it, man.
No, I really appreciate you, Ron, for doing this, and you were the one that really turned me on into this whole space. So improving life through airway. So
cool, man.
Appreciate you doing this for me, and glad to finally meet you.
Sure thing, bro. Yeah, I'm glad we finally got to meet and hang out and have a coffee and all that.
Yeah, for sure, man.
Good stuff, man.
Good
luck, all right?
Appreciate you, man.
Thanks a lot for the interview, man.
Yeah.
It was awesome. All right, so we had just signed off, but Eric wanted to just share one other important piece that didn't come up during the main interview, so go ahead.
Yeah, so I'd say 10 days after the surgery, I had a post-op follow-up with Dr. Alfi. That's when he took a CBCT scan.
Was that your first post-op CBCT?
My first post-op CBCT, and that's just to make sure. I mean, everything is right, but they do the airway measurement, where he measured the pharyngeal airway space, and all my pre-CBCTs were my minimal cross-sectional area for the pharyngeal airway was upper 100s, like 170 square millimeters.
Does that come up as red on the thing, or
I
orange?
believe it's orange.
Yeah, I think
so,
red is sub 100.
Yeah, so it was low, but not severely low. And then after the CBCT, even swelling and everything, it was 480, and that was the minimal. So it was a blue ocean.
So the bottleneck, the most narrow point of your pharyngeal airway, in that slice that everyone knows about that's meant to measure the airway, where you get the rainbow of colors, where red is narrow, orange is narrow, and then once you get blue, that's healthy. You went from having an orange kink at, what did you say, 190?
170, yeah.
Oh, 170? Is that millimeters squared?
Square, yep.
And after surgery, the most narrow point was?
480.
480.
480,
So you more than doubled.
Yeah, almost tripled.
The bottleneck.
Almost tripled the cross-sectional area, the minimum, to where there was no bottleneck.
Right.
And then, and that was with 8 and 9 millimeters of advancement.
Wow, incredible.
So.
Incredible. Yeah. And so that presumably is good for this sort of thing.
Right.
Right? When people don't have enough space for their tongue to come forward, it kinks their throat, and then they get that narrowness in that slice on the CBCT in their pharyngeal airway. So, well, good,
and for
man.
me, it was I was pretty wide. The airway was wide in this dimension.
Show the camera, the airway was wide in what dimension?
Yeah, so it was wide this way.
Yeah.
But it was, in the AP dimension, it was narrow.
Yeah, right.
Right, so that's why advancing it had such a magnitude effect.
Yep.
Right?
Yep.
Because you're lengthening the smaller dimension.
Right. Yeah, and all of that kind of jives with your whole case in general, which is you were kind of a fence case, 170 millimeters squared cross-sectional area at the kink. It's not horrendous. Some people are much less than that.
Yep.
A lot of people would have said you were fine, nothing wrong, but you do this surgery, you get a 9 millimeter maxillary advancement, 10 on the mandible, or was it 8 and 10?
8 and 9.
8 and 9. And now you get that blue ocean you talked about, which is just wide open. It all shows blue on the CBCT, and should pay dividends in terms of your sleep. You know?
I hope so, yeah.
Good stuff, man.
Yeah, sure.
Thanks for encouraging me to turn the camera back on and get that, because that's super useful information. That's where my kink is. I bet you know what? And I was telling you off camera that if I were doing an MMA, it would probably be very similar to yours. Maybe a little less.
Yeah.
But that's exactly what I feel like I have. Maybe like a 170 kink, which is just 1 or 2 times a week. I'm waking up on my back with my shit down in my throat, and like waking up from a bad dream feeling like I'm choking.
Yeah, exactly. And maybe affects neck posture too. And
definitely affects neck posture a couple of degrees.
Yeah.
You know, enough that you can have headaches once in a while, neck tension once in a while if you overdo it, right? And we're in the terrain of biohacking now. It's like we want to go from okay to good, or from good to great, not necessarily trying to cure the stuff that's in the textbooks about, jaw surgery is only valid under these very strict circumstances. We're biohacking. We're trying to take our experience of life, from good to optimal by tweaking our bodies and our lifestyles. So I'll bet you a similar MMA would produce a similar result for me, and it kind of makes me want it.
I think so.
Yeah. I'll have to
You'll have to
get scanned up before I leave.
I'll get the CBCT scan.
Yeah.
Yeah, for sure.
No, I'm just kidding. Well, see, my wife is going to kill me.
Even all the occlusion scans and all that.
Yeah, get prepped.
Exactly. Get prepped.
Have them write me up an estimate for the surgery.
Man, you're good, man. You're good, but.
Nah, we'll see. Never know what the future brings.
Yeah. But that was one of the. I mean, when you mentioned biohacking, that was, it was. I remember I had a conversation with my brother, and this is when I was having second, doubts about it, where, there's the, do you really need it question that you constantly ask prior to MMA, and one of the things he said, he was like, yeah, but like you don't want to live a mediocre life where you're just kind of like fatigued and kind of getting through it. Sure, we could all get through it. You want to live your best life, right, where you have optimal energy. You look your best. You address the problems as they come to you.
Yeah.
Type of thing. So, and I think this is a part of it.
Nice, man.
So.
Yeah, no doubt.
Yeah.
No doubt. All right, good stuff, man. Yeah, we'll jump off for real
All
this
right.
time. All right, good shit, man.
All right.
All right. Peace out, everybody.
Yeah.